Hello everyone, once more welcome to Cecilia Medical Trust. Today we are here again to shine more light on another very essential healthcare tool that many of us may overlook, which is urinalysis, right? And I'll invite you all to join us as we explore some common questions with our skilled and knowledgeable lab scientist by name Mr. Santos Oner, as you can all see him, who will be providing us with expert insight into this vital procedure. So let's dive in and empower ourselves with knowledge. And to kickstart, let's start with the basics. Many people hear the term urinalysis, but may not fully understand what it entails. So, can you tell us, sir, what urinalysis is all about and why is it such an important test for our health?
Well, of course, Mr. Ronald. First of all, I'd like to thank you for providing me this platform. I am the laboratory scientist at Cecilia Medical Center. We are located just directly opposite the Faculty of Health Science, beside the Bomaka entrance, on the Zenith building, the Zenith Insurance building. Okay, now to dive straight into our topic for the day, I'd like to start by defining what urinalysis is. Urinalysis, or also known as urine analysis, is basically just analysis that has been done on urine to test for certain substances and certain properties as well. So this test involves it involves microscopic tests, chemical tests, as well as physical tests. The physical test includes analysis on the color and on the quality or appearance, and then for the chemical test you have tests that conduct to check for the levels of certain substances such as glucose, specific gravity, the pH, leukocytes, microalbumin, and many more. Meanwhile, the microscopic test is basically just examining the urine sample under the microscope to check for certain bacteria and parasites that could be found in it, as well as blood too. And for the importance of urinalysis or urine analysis, urinalysis is very essential in diagnosis. This is being used to monitor diseases such as kidney disease, as well as liver diseases as well, because the parameters that have been tested in urine analysis tests also include glucose, albumin, and others that can be used to monitor kidney and liver function. It is also used to diagnose certain urinary tract infections as well. So urine analysis is a snapshot. It's a snapshot of the health state of an individual's urinary system. Sorry.
Oh, wow. Thank you very much, sir, for that great insight. And so far, you've told us what urinalysis is all about. And now that we know what urinalysis is all about, so who are concerned about maintaining our health, understanding how often to undergo urinalysis is key. How frequently should individuals consider having this test, sir?
Alright, urinalysis test, first of all, is tailored according to the individual's healthcare needs at a certain point in time. For individuals who have kidney diseases or liver diseases, or individuals who are diabetic as well, it is being recommended that they undergo this urinalysis test more often to check for the functioning of the liver, the kidney, and other organs as well. Meanwhile, individuals who are also seeing symptoms like maybe burning sensation when peeing, or maybe abnormal or frequent urination, or many others, you can also request to do a urinalysis or urine analysis. And then also for people whose health are okay, but you just want to do a general checkup, yeah, you will also fall into the category of the people who might need a urine analysis test.
Oh, wow. Thank you very much, sir. And to go for the urinalysis, like you earlier said, it's a test, and I'm sure based on your expertise, it requires a lot of accuracy, right?
That's true.
And this in turn demands some preparation. So tell us, what should individuals do to prepare for a urinalysis?
Well, thank you. That's a very nice question. I really like answering this one because there are many patients who fall behind when it comes to knowledge of what they should do before a test such as urinalysis. For urinalysis, before you do the test, first of all, you have to inform the healthcare service provider if you're on any medications such as antibiotics or vitamin D supplements or any kind of medication at all. And secondly, you have to hydrate. That's you need to drink a lot of water to be able to provide the urine sample for the test. So first of all, drink a lot of water before the test. Number two, you need to inform the healthcare provider if you're on any type of medication before the test. Number three is you need to avoid certain foods that contain a high amount of sugar, like this sugary beverages, ice cream, chocolate bars, candy bars, and all the rest. You need to avoid it because these are certain things that are going to um, give you faulty results. So number one, you have hydration. Number two, you have medication. And number three, you have food or diet.
Okay, well, thank you very much, sir. To go further again, so we have more some other questions we would like you to clarify us on. More often, people always talk about the urine color having, basically it exhibits a range of colors, and each can possibly signify probably different health statuses, right? So, can you explain what the color of urine actually indicates?
First of all, I'd like to talk about three principal colors, the ones that are more common. First off, we have pale yellow. Pale yellow just signifies that you're well hydrated, and it does not actually mean that you're fine. You could still have a pale yellow urine, which is not very clear, which could signify a UTI. The pale yellow just means that you're well hydrated at the moment. Then you also have deep yellow or amber, as we call it in the lab. That's the color. It signifies that you're dehydrated. And then you have brown, or in some cases red. It signifies severe dehydration. And in some other cases, it signifies that there's blood in the urine. That could be from irritation of the urinary tract or maybe a UTI.
Okay, thank you very much, sir, as well. Um, Before we end, sir, I also like to find out, there are often myths or misconceptions surrounding medical tests, that can lead to possible misunderstandings. So I'd like to find out from you, sir, what are some common misconceptions that people can possibly have about the urinalysis?
Okay, I'd like to start with the most prevalent or the most that I've heard from so many people before is that people believe that urinalysis is only for women. Well, this is not the case. Like I said, it's being used to monitor diseases such as kidney failure or kidney diseases, liver diseases, as well as diabetes. And I'm sure we all know that kidney diseases, liver diseases, and diabetes does not affect only women. Even UTIs does not affect only women. There are men also that suffer from certain UTIs as well. So urine analysis or urinalysis is not just for women. It's for men, women, children, everybody, for all age groups. And the second misconception that people usually have about urine analysis is that it's used only to tell or only to detect if you have a UTI. Like I mentioned earlier, it's used to access kidney function, it's used to access liver function as well. So it does not only end at the level of urinary tract infections.
Oh, wow, that's great. And finally, so you have talked a lot on urinalysis, which has really enlightened us and has changed the way we see things. I would like us to, I'd like you to talk to us. Tell us about prevention. What steps can individuals take to maintain good urinalysis?
Okay, so basically taking care of your urine or maintaining good urinary health is basically in effect you have to take care of your urinary system as well. So number one suggestion is hydration. Hydration is always very important. very, very useful for the urinary system. Number two, we have healthy habits, healthy dieting habits. Eat a lot of fruits, drink a lot of water, eat healthy, balanced diet helps. So number one, you have hydration. Number two, you have diet. Number three, you have sports and exercise as well. Very important to maintain good urinary health. You also have to stop certain bad habits like smoking and alcohol as well, for that to damage your urinary tract and infect certain organs that are found in the urinary system, such as the kidney.
Wow, 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 wow. Thank you very much, sir. Thank you. We can't thank you enough, but we hope that God will bless you for this knowledge you've given us. And as you all can see, we have a good lab scientist on ground. And at Cecilia Medical Trust, we have a dedicated team that is committed to providing good health care to our patients. And urinalysis is also a part of that objective. So, if you have further worries that needs to be clarified, do well to put your questions at the comment section. And from time to time, we'll be giving you good videos on health education. See you in the next video.